Okay, hi, I'm Dr. Willmitch and I'm here with Courtney. Basically what I'm going to do is just ask Courtney some questions about her condition, her history with it, what's been done here, how she's feeling now, and that's pretty much it. So first of all, what I want to ask you, Courtney, is what were you diagnosed with when you came to our office?
I was diagnosed with fibromyalgia and chronic fatigue.
Okay, and how long were you diagnosed with those?
By the time they realized the name of it, it's been 15 years.
Okay, and what types of doctors had you seen prior to coming here?
I've seen the GP and the internist and the rheumatologist, and I've been told or referred to go to the psychiatrist. I've seen quite a number of doctors in different fields.
Okay, what was their treatment of choice for you? Or what did they try for you? Let's put it that way.
They gave me a wide variety of prescription drugs.
Okay. Any of them seem to work?
No.
Okay.
And unfortunately, I am susceptible to side effects like many of you at this website. And if there's a side effect, I pretty much get it. So
We've gone through those.
Oh, we've gone through those. So that didn't help matters, trying all these different prescription drugs having every side effect that you can think of.
All right. Let me ask you real quick. What types of symptoms brought you here? What were you experiencing personally?
There's the train in the background. Hello, train. Okay, my every muscle was aching in pain. I had a constant daily headache. I had the dry mouth syndrome, mostly from the drugs, but also from this condition. I had, in addition to the daily headache, I had migraines that were very painful. And many years before I came to see you, the migraines were so bad I was in the emergency room 2 and 3 times in a month, which is a horrible thing to have to do because they're not very sympathetic in the emergency room. So that was no fun. And a lot of trouble sleeping and
Hyperacusis?
oh yes, what you're doing. Yes, and I have an unusual condition that many people have never heard of. That's right, it's bilateral hyperacusis, which means my ears hear extra well. I have the equivalent of what Superman's hearing is, but I cannot turn mine off like he can. It's on all the time.
All right. And basically, now that we're almost through your treatment program, just briefly, how are you feeling now? What improvements have you seen?
Oh, it's such a huge difference. There's not even words to describe the vast improvement. I am not in constant pain like I was. Of course, there's still pain, but it's not the level it was before. And I don't have migraines except maybe once a month, if that. And I don't go to the emergency room for it. And the daily headache is gone. I don't have the daily headache at all. My sleep pattern is much improved. I'm not sleeping 8 hours a night, but I didn't expect to sleep 8 hours a night. Before this, my sleep pattern was about 1 hour, and I'd be up, and then it would be maybe 1 or 2 hours, and I'd be up all night long. And now I can sleep at least in 3-hour blocks of time and a 4-hour block of time before I have to get up. Much improved.
Okay. And overall, pretty happy with your outcome so far?
Absolutely.
Okay.
Absolutely.
And you're going to stick with your homework?
Yes, my homework,
yeah.
which is my diet.
Yeah.
I have a terrible eating habit, and I have for a long time apparently. I didn't know I was doing so many things wrong, but I'm doing a lot of eating wrong.
And you're going to start working on those more diligently.
Yes, indeed.
And you're going to continue to see results.
Absolutely.
Good. All right.
Absolutely. And
All right.
let me just add quickly for the people out there watching this video that unlike the other doctors, which unfortunately are not as sympathetic as they could be, Dr. Willmitch is very sympathetic and he's in tune with you. And this particular therapy is not just take a pill and it'll go away, because if any of you have had fibromyalgia and chronic fatigue for any length of time whatsoever, you know the pill does not make it go away. Yes, it helps the pain maybe, and yes, you get to sleep for one night maybe, but it's not a everlasting, ongoing improvement. It's a very start and stop improvement. It's not overall, it's not for a long period of time. And Dr. Willmitch's program really does give you results that are continuing results, because it's not based on the pill and which way your system is going to accept the pill or have side effects to the pill.
Well, thank you. I appreciate that.
Right.
All right. Thank you very, very much, and I appreciate it, and I hope that helps.
Oh, thank you, Dr. Willmitch.